Hello, and welcome to part two of our pulmonary pharmacology drawings. Today I'm going to be going over antibiotics. So keep in mind, actually pretty much all of these drawings except for one were done during our first module, so they're a little interesting. So we're going to get started with our macrolides. So we're going to focus on this big bottom picture right here. So this scene takes place at a water park where outside there is this really big red water slide. So big slide for macrolide. And the drugs in this category are clarithromycin. So it's very clear, a clear day. There's not a cloud in the sky. So clear for clarithromycin. We have the slide, which is red for erythromycin. And then Darth Vader here he's a Sith Lord, so azithromycin. And so there's a lot of stuff going on in this picture, but I will just try to focus on the stuff related to the respiratory. So mechanism of action for all these macrolides is that it works on the 50S ribosome to inhibit protein synthesis. So like I said, it's a very clear day. There's not a cloud in the sky. So you want to make sure you have some really strong sunscreen on. So we have 50 SPF sunscreen for 50S ribosome. And we'll just start with azithromycin. So azithromycin treats a lot of things. It treats otitis, which is why he's got a big ear. He's got his little wangy dang, his lightsaber, out because it treats STDs. But we're going to focus on community acquired pneumonia. So he's wearing a baseball cap. So cap, community acquired pneumonia. So anyone who's wearing like a hat or a cap is for community acquired pneumonia. And so all these drugs treat that. And they also, so the bacteria that cause community acquired pneumonia are your atypicals like mycoplasma, which I have written on the slide. It also treats streptococcus and staphylococcus. So this cutie here, she stripped down her clothes, so stripped down streptococcus. This lady, her name is Phyllis. She is a grandma. My grandma's name is Phyllis. That's why I came up with that. But anyways, Phyllis for Haemophilus influenzae. And she's holding her staff, her cane, her staff for staphylococcus. And yeah, so these are going to be mainly your outpatient antibiotics for those bacteria, because streptococcus, staphylococcus, H. flu, mycoplasma, those are like your typical causes of community acquired pneumonia. And the adverse effects are QT prolongation. So like I said, this QT here, QT prolongation. And Phyllis is puking in a trash can, so GI symptoms. So those are your macrolides. Next, we're gonna come back to our carbapenems. I'm gonna focus right now on our tetracyclines, which is this top right picture here. So we have a big tiger, and on his face are these, do you remember the game Tetris? He's got like the little Tetris blocks on his face for tetracycline. The two drugs in this category are your tigercycline and your doxycycline. So obviously that's why tigercycline, that's why he's a tiger. And his name is Doxy, just because, I don't know, it's like, oh, come here, Doxy, come on. And the mechanism of action is that it works on the 30S ribosome unit. So we have a 30-pound bag of tiger food, not children food, tiger food, because remember, tigercycline, the adverse effects is that it's not used in children under 7 because they have effects on teeth and bone growth. And both these drugs treat community acquired pneumonia and MRSA. The other adverse effect is photosensitivity. So we have our sun here. And trying to think if there's anything else to add. Tigercycline is an IV drug. So I remember that by looking at how sharp these teeth are, like IV sharps. And so tigercycline would be more of your inpatient community-acquired pneumonia treatment. So like I said, I'm going to skip carbapenems. We'll come back to that later. And I'm going to move on to our fluoroquinolones. So in this picture, this is taking place in a bar. So we have this person, he's dancing over here on the dance floor alone. We have this guy who's sitting here sipping on a drink. We have our bar. So our fluoroquinolones, like I said, we have this guy, he's dancing on the floor alone, fluoroquinolone, and he is gyrating his body around. He's getting it. He's gyrating all over the place because the mechanism of action that is that it binds to DNA gyrase. So DNA gyrase is that thing that is responsible for breaking open the DNA. So if DNA can't break open, then it can't replicate. So the drugs that are fluoroquinolones are moxifloxacin. So this guy, I spelled moxie wrong, but he's got moxie. He's just out there on the dance floor gyrating. He's confident. He's got moxie. So moxifloxacin. And we have the lever that you pull to get beer out of lever, levofloxacin. And like I said, this guy over here, he is sipping on a drink, ciprofloxacin. So Cipro, it does treat Pseudomonas, and I draw Pseudomonas by a rug because Pseudomonas aeruginosa. Cipro does treat that, but it's not a respiratory fluoroquinolone, so don't use it for this. But levofloxacin does have pseudomonal effects, and it can be used to treat community-acquired pneumonia. That's why we have our cap on the back wall here. And moxifloxacin does not have pseudomonal effects. It doesn't treat UTIs either, whereas levofloxacin and ciprofloxacin do treat UTIs. That's why they're kind of by the bathroom here. And the adverse effects are photosensitivity and connective tissue dysfunction. So there's a box of tissues here, and also central nervous system effects. So he looks a little nervous about the way he is dancing. I think that is it for those. Both levo, all of these are both IV and parental forms, so they can be inpatient or outpatient. Next, I'm going to talk about our penicillins. So this scene is at an outdoor concert. We have a lot going on here. So there was obviously supposed to be someone singing, but this ox came in, he took over the stage, this hippie, he's smoking like a vape pen with, whatever, pen for penicillin, vape pen. He's like, I don't know what's going on, man, but I'm just living life. I'm playing my acoustic guitar with an amp, even though acoustic guitars don't use amps. And then we have this dude being attacked by a dog, and this security guard thinks he's going to save the day. So, penicillins, the mechanism of action for all these is that they bind to penicillin binding protein, inhibit cell wall synthesis. And adverse effects are just rashes and allergic reactions. So, I'll focus only on the penicillins that were covered for this respiratory unit. So, we will start with ampicillin sulbactam, which is shown up here. Now we have this sign here that says Better Call Saul, and this is a reference to Breaking Bad. And so if you haven't seen that show, In Breaking Bad, there's a lawyer. His name is Saul Goodman, and his motto is Better Call Saul. And so we have this dude here who's getting his leg gnawed off by a dog. So he probably needs a lawyer, right? So Saul for ampicillin, Saul Bactam. This treats community-acquired pneumonia, among a whole bunch of other things, such as intra-abdominal infections, dog bites, diabetic foot infections. That's why we have all this going on here. Amoxicillin clavulanate, also known as augmentin or dogmentin, is the follow-up, the oral follow-up for ampicillin sulbactam. So if you're treating community-acquired pneumonia and you're doing it outpatient, you would use amoxicillin clavulanate. If you're doing it inpatient, you would use your IV ampicillin sulbactam, also known as Unison. You also, in this category, we have amoxicillin. Oh, it's here. This is a mockingbird for amoxicillin. This is the drug of choice for otitis, but it is also good for pneumococcus. It is good for pneumococcus. That's not in the picture, but just know that. Another penicillin that can be used for respiratory infections is nafcillin. So over here we had an ox for oxacillin. He has 2 clocks on his back, dicloxacillin, and he's taken a nap from nafcillin. The only one you need to focus on is nafcillin, but it's a beta-lactamase stable drug. So we have this big, heavy ox on this stage, but the stage is stable. It is holding him up. And these all have anti-staph properties. So this staph member, he's like, run away, there's an ox. So, and he's purple because Staphylococcus is gram-positive. Then we have piperacillin tazobactam. So this security guard, he's got his pepper spray and his taser. So pepper spray, taser, tazobactam. And he's like, no, bad dog, get away. So no for nosocomial infections, because that's what this treats. And it also treats Pseudomonas. So he's standing on a rug. Next, we'll move on to our cephalosporins. So full disclosure, most of these came from osmosis videos, but just in general, our cephalosporins, we have our 1st through 5th generation. And just generally speaking, I'm reminded of Cram the Pants when he was talking about how if you think of these like a podium, so 1st place, 2nd place, 3rd place, the person who comes in 1st place, they are really positive. They're very happy. They're positive about their accomplishment. So 1st generation cephalosporins are really good at treating gram-positive organisms, whereas someone who comes in 3rd place is a little bit more negative. So 3rd generation cephalosporins are better at treating. They have a little bit more gram-negative activity. So just keep that in mind as we go through here. 1st generation, we have Alexander the Great playing the violin. So Alex for cefalexin, and he's playing the violin for cefazolin. These both treat community-acquired pneumonia. So he's wearing a hat. It's not a baseball cap, but it's still a hat, so cap. And cefazolin is the IV equivalent to cefalexin. So if you're treating community-acquired outpatient, you're going to use cefalexin. If you're treating them inpatient, cefazolin. Then looking at our 2nd generation, we have cefprozil. So I have like a set of headphones that are a pretzel, Prozil. Don't worry about cefatine. Our third generation, I have a little story about this one. So this guy here, this man, he took a taxi ride, and once he was done, the taxi driver was like, all right, that'll be 10 cents. And he's like, what the heck? 10 cents? I ain't paying that. So he stripped down and threw an axe at the taxi. So so now he's naked. Decided to go streaking. And just the only reason why he's naked is just because these treat skin infections and meningitis. But the main point here is community acquired pneumonia. So he's wearing a hat. He's stripped down naked except for his hat. So he threw a three-headed axe at the taxi. So triaxone, ceftriaxone, taxi for ceftaxime. And the taxi ride was 10 cents. Sorry, ceftazidime. That's an M. So 10 cents for dime. Then there's some other drug, like combination drugs that are new, and that's ceftazidime avibactam and ceftolozane tazobactam. And these, along with ceftazidime, are good for treating nosocomial and Pseudomonas infections. Then our fourth generation is cefepime. Brand name is Maxipime, so I drew a maxipad for Maxipime. And then our fifth generation is ceftaroline, so tar and line. This is a road that was paved with tar, and there is a line on the road, so ceftaroline. And if you're standing in the road and you get hit by a car, like you better, I don't know, you better have some mercy, I guess. Mercy, MRSA. So this is like the only cephalosporin that treats MRSA. And again, I should have mentioned this before, but all of the cephalosporins, they bind to penicillin binding protein, inhibit cell wall synthesis, and they have the same adverse effects as penicillin, which are rashes and allergic reactions. So now we'll talk about the carbapenems. So we have our Hunger Games symbol here because that whole thing took place in the country of Panem. So carbapenem, Panem. And again, these bind to penicillin binding proteins, inhibit cell wall synthesis. That's kind of shown by this circle around the outside. It's broken up because the cell wall is being inhibited. Adverse effects are still your rash. And the drugs in this category are meropenem. So we have our mockingjay, meropenem. They both start with M's. The character, so not Katniss, but her sister, her name was Primrose Everdeen. So Primrose for Primaxin, that's the brand name of Impopenem. And then Everdeen for ertapenem. So they both start with E's. Primrose and Primaxin will start with P's. So the colors here are really important because the mockingbird, the meropenem, is in gold. So meropenem treats anything that's in gold. So meningitis, not important here. But Pseudomonas and nosocomial infections is what you want to focus on. That's what meropenem treats. Then the primrose here is in red. So impopenem, or this Impopenem celestin, treats anything that's in red. So intra-abdominal infections, and then also pseudomonal and nosocomial type infections. Then ertapenem treats all the things that are in green. So the only one that's important is right here, community acquired pneumonia. And then I will talk about the aminoglycoside. So we're going back to Star Wars references. I think I'm gonna go to the dark side. I'm gonna go to the dark side. Aminoglycoside. And the main reason I thought of that is because one of the drugs is Amkin, which kind of sounds like Anakin Skywalker. Anakin Skywalker. He went to the dark side. Other drugs in this category are tobramycin. So I have this little Toblerone chocolate thing that you buy at the airport. It's sitting on a rug. And then the other drug is gentamicin. So these hands are very gently holding this weight. And again, this category treats a whole bunch of stuff like ototoxicity and abdominal wounds and skin infections, but the main focus is on pneumonia. And tobramycin is the first line for Pseudomonas if you're using it with another agent. Amakin is reserved for resistant organisms, usually aerobes. So think Anakin Skywalker. He always looks like he's walking around in like a bathrobe, robe for aerobe. They're gram negative. Oh, I probably should have mentioned this before, but the mechanism of action is that it works on the 30S subunit of the ribosome. So these gentle hands are holding a 30-pound weight. And the adverse effects are things like nephrotoxicity, ototoxicity, renal. You want to be careful with renal function. Yeah, I think that's on it. We're going to skip this middle picture here. And we're going to talk about our glycopeptide, which is vancomycin. So we have a ice cream truck, a van, and ice cream trucks, they're peppy. They're singing, playing music. They got a lot of pep to them. So glycopeptide. And this kid, he is like, Lord have mercy, it's so loud. I just want him to shut up and go away because he doesn't want C. diff ice cream, which I'll get to in a minute. But anyways, MRSA. Vancomycin treats MRSA and it treats C. diff, your favorite flavor of ice cream. And vancomycin, so it's a purple van because it only treats gram positives. Mechanism of action is that it binds to cell wall precursors, inhibiting cell wall synthesis. It is used intravenously for your, like, if you have a person who has pneumonia from MRSA, you're going to use the IV, and you're going to use PO if they have C. diff. So, but the main thing here for respiratory is if you have a hospital-acquired pneumonia caused by MRSA, you're going to use vancomycin. We're going to skip this other one down here. And we're going to move on to yet another oxazolinone. That's the class, and the drug in this class is linezolid. So I think a solid line, linezolid. So we have an ox with a solid line drawn between his horns. This inhibits protein synthesis at the ribosome. So this little thing here is supposed to look like a cowbell, but like also a ribosome. And these are used to treat resistant gram-positive organisms. And it's used when all other drugs have failed. So gram-positive, he's purple. And adverse effects are neuropathy. So that's a brain, bone marrow toxicity because antlers, those are made out of bone marrow toxicity. And then he is got this cute little smile here because he has serotonin syndrome. We'll skip this one. And then the last antibiotic, which we have not learned about yet, is colistin. So we have this lady, she's at a grocery store shopping, and she has two grocery lists, so colistin, and she is buying cat detergent. So cation, the mechanism of action, it's a cation detergent, which damages bacterial cytoplasmic membrane. So damages bacteria. And this is only used for the most resistant pulmonary infections. So it's like your last line, your last option. And to show that her lungs were being very resistant today, they're like, please don't make us go grocery shopping. And so she's got them on a leash and she is just dragging them along because they're being very resistant. Adverse effects are neuropathy. So we have a brain in a jar, nephrotoxicity. So we have a kidney in a jar. And then respiratory tract paralysis. Again, her lungs here, they're paralyzed. They're like, no, don't make us. And so that's why she's dragging them along on a leash. So that is all of our antibiotics for respiratory infections.